The geriatric patient. A lot of times during this aging process, we're using a lot of our body systems, and in some cases, these body systems start to deteriorate. That includes things like the eye and vision loss, our ears and hearing loss. In some cases, we may develop some type of dysphasia, unable to communicate. There may be even some cognitive dysfunction and decline due to strokes, dementia, Alzheimer's, and delirium. We also have issues where we develop respiratory problems such as pneumonia or chronic bronchitis or chronic obstructive pulmonary disease. We develop myocardial issues such as the heart attack, angina, congestive heart failure. This may also lead to GI upset and discomfort such as peptic ulcer disease, constipation. We may have some bowel and bladder control where we have incontinence. It would also lead to maybe even having deterioration in kidney function and where the kidneys no longer do their filtration system as well as they should. Keep in mind as we evaluate our patients for these conditions, such as a heart attack, due to their previous heart problems, the high blood pressure and other congenitive, well, not congenitive, excuse me, it would be more of our chronic degenerative illnesses. Over time, it makes them more likely to having these events, but making it an issue for us to communicate because of these issues with effects of aging on the body systems. Now, not only are they aging and the body systems are being affected, in some cases they may be on multiple medications at home. It may look like they have a whole bunch of meds. And so we'd have to take these meds and decipher what each med is used for. And by understanding what they're used for, it may give us some idea as far as what's happening on the case that we are responding to today. Now, we need to appreciate that during this decline in body systems for geriatric patients, these become now their normals. So as we review back to the lifespan and vital signs, we know that as we get up in age, our heart rates and blood pressures change. We lose the ability to maintain a body temperature because the thermoregulatory system changes a little. And we may be on medications that affect either our heart rate or blood pressure. So a normal person that might be compensating for some type of blood loss may have an increased heart rate, whereas our geriatric patient that's on medications such as a beta blocker to decrease the heart rate may have a heart rate that's much lower than what we would assume. And also assessing their blood pressure, because they may have high blood pressure or hypertension. For them, their blood pressure at 180/90, if they were to all of a sudden drop their blood pressure to 120/60, this is what we would consider to be a relative hypotension, which means that they would be significantly suffering the same thing as someone having a blood pressure of 90 or less systolic. So keep in mind those baselines. Again, we go back not only to vital signs in identifying baselines, but the cognitive functions and ability for them to communicate their issues to us. It may be that they have some cognitive decline, so they may not understand the questions. They may also have a hearing or visual impairment that they may not be able to see or hear what we're saying. So the idea is that we're not trying to yell at them, but rather speak directly to them in a slower, more clear method so that they can understand our questioning. We may, in some cases, have to write these things down on a piece of paper, or we may need to use hearing aids for them to hear a lot closer to the questions that we're asking. Please review your chapter on geriatrics.